Hey everybody, it's Adam Farkas. Welcome to another edition of ODwire TV. And as you saw from the intro graphic today, we're doing another one of our Best Practices series today. And today we're really fortunate to have with us Dr. Stephen Cohen from Scottsdale, Arizona. He was one of the 2018 Best Practice honorees, and he's a PCO grad who's been in private practice since 1985. He's the past president of the Arizona Optometric Association, also voted the top OD in Arizona and one of the top 10 optometrists in the US. So he's got a wealth of experience. And one other thing that I didn't know about him until I started researching this was that he's also the past president of the Desert Foothill Theater and the lead in over a dozen productions, including The Odd Couple, Dial M for Murder, and The King and I. So he has got an extensive history and is, dare I say, Stephen, you're a Renaissance man.
I'm a legend in my own mind, Adam.
And that's the best kind of legend to be, trust me. The first thing I noticed when I was, getting ready for this interview is I went to your website and I saw that your tagline was, "Where modern technology has met old-fashioned or old-school care." So I thought that was really interesting. So could you describe your practice for us a little bit?
Sure, I'd be happy to. The challenges that we all face in practice is that advance in technology played a great role in assisting us with diagnosis and treatment and patient flow, but at the same time, it risks eroding away the personal relationship between the doctor and the patient. So, and the medical model has done the same thing because the approach that we take is more delegation and shortening the time period that we're spending with our patients. And, that a common refrain that I hear is that with more that we have to share with patients, more we have to talk about with patients, more testing that we have available, we have less and less time. So where does the relationship portion of that fit in? So when we talk about modern technology and old-fashioned care, it's now become almost a dichotomy because the two can become mutually exclusive. And my focus has been to marry the two, to embrace all the new technology that we have available, but at the same time not lose touch of that personal relationship. And I think that personal relationship needs to be front and center as the hub of all aspects of the encounter. And when you look at, a common, in almost any field, medical and otherwise, customer or patient service is heralded as the backbone of a business, and yet why is it that so many people complain that we don't have that kind of personal service that we used to have in business world? And to me, a perfect example is a portion of new technology that I don't want to embrace, and that's the automated phone system. We're in a service field, and yet what do we hear when we call another service industry or someone calls our office? We might hear, for your convenience, we've implemented a new phone system. Well,
right.
No, I'm sorry. If you've done it for more convenience, I'd be talking to a person right now and not having to press a prompt to be able to get to a human being to address whatever it is I'm calling about. So I think it's indeed a challenge to effectively manage the time that you have with each patient, but establishing that rapport and trust is really paramount to building patient loyalty and to having a successful practice.
Absolutely. One thing that I've noticed too a lot these days, when you go into a doctor's office, a lot of times the doctor really isn't facing you, right? He's facing a laptop or an iPad. In your own practice, how do you sort of convey to the patient that you're giving them your undivided attention and you're not sort of sucked into your device when you're working with them?
It's a great point, Adam, and I've had patients say to me that they've been to doctors' offices that they said if 10 minutes outside they bumped into the parking lot, the doctor wouldn't know who they were because they've made no eye contact. I'm a social butterfly by nature, so that direct eye contact is so important to me and just to my own comfort level. So what I try to do is, first I always apologize for the fact that our requirements necessitate the documentation, but I try to do that in chunks where I'm making that eye-to-eye contact and face-to-face, and then I'll type in some of the notes or at the end of the exam put in some of the findings, but spend as much time as I can with direct eye contact. And if I do spend a little time writing something, I will then review that with the patients so they understand what it is that's being documented and what purpose it plays. It's a great point that you raised. I know there are a lot of doctors now who are using an iPad so that they can face the patient. I've done that as well. And sometimes may have a scribe is another method that's being used. But whatever method is used, there has to be that time in which there's not talking over one shoulder to the patient about what's being found while typing, but to stop, turn, face the patient, make eye contact, and communicate both verbally and non-verbally.
Right. And in your own practice, do you make any use of assistants to sort of delegate this more mechanical stuff to give you more time for the high touch?
Yeah, I do. We have the delegation, though, in my practice is isolated more to the pre-testing, which would be the general history taking, and then auto-refraction, auto-Ks, it might be a retinal photograph, some of the other things that we may do. The refractive portion and everything else that I do in the exam room, including reviewing the history to be able to glean more information. We're also very big on transfer of authority where the information is conveyed, so that when my tech comes in to turn a patient over to me in my office, we first go over everything that was found in the history so that when I go into the exam room, I'm already familiar and I may already have an idea of follow-up questions that I might want to ask and how I want to proceed, or at the very least, which I think is really critical in practice, to be able to say to the patient, I understand that A, B, and C, so that they know the information that was given to the tech has been repeated. That transfer is also important when we might transfer a patient, say, in our optical, to repeat the information in front of the patient and in front of the optician. For example, I've said, Adam spends a lot of time on a computer, so we talked about a near variable, and we talked about the effects of blue light, because there are two things I'm looking for. One is to make sure the information is given to the optician of what we talked about in the exam room, and the other is what I call the bobblehead response, which is that I want to see the patient nodding their head in agreement that, yes, that's what we talked about in the exam room, so that they know the valuable information they felt they got in the exam room has now been conveyed to the next person they have to deal with.
Right. And, you mentioned before that sometimes, the people have said that a doctor wouldn't recognize a patient if they saw them in the parking lot 10 minutes later. Are there any special techniques that you can share with folks about how to make that patient feel special, like they are the center of the universe when they're with you for that, brief 10 minutes?
I think the first is that undivided attention, which sounds very simplistic, but it isn't always when we're faced with busy schedules and medical records and everything we have to do. But establishing that rapport. So first would be spending a few minutes just in general conversation. How are you doing? How was your weekend? Do you have any travel plans coming up? What's going on with the family? And a lot of times when patients will share information that it can be very helpful for the future in helping to build that relation. For example, if I have a patient that says, my daughter's getting married in 2 weeks, is there a chance my contact lens may be ready by then? I'll go ahead and I'll write down daughter getting married in 2 weeks. What it allows me to do is then when I review the record the next year, interestingly enough, often when I write it down, I'll already remember it even before seeing it in the notes. But at the very least, I can see it there. So when I go into the exam room next year with that patient, I have the chance to say to her, hey, how was your daughter's wedding? And if they say to me, gee, I'm surprised you remember. Well, I remember you needed the contact lens you were hoping to have because you didn't want to take pictures, with your glasses on. If I walk in and a patient is reading a particular book, say they're reading a Stephen King book, I might write that down so that the next time they come in, I have an opportunity to say, have you read his latest book or what are you reading lately? So any things that help to build that connection, I think becomes tremendously valuable. But it's not only rewarding to establish the relationship with a patient, it's rewarding to me as a practitioner. This is my 34th year in practice, and I love what I do now as much or more as any time in my career because of those relationships. Just yesterday, I did an examination of in the infancy program and found out from the patient's grandmother later in the day when she came in that is now the 5th generation of this family that I've seen.
Wow.
That's incredibly rewarding and exciting. But there are so many things that we can get that make the day interesting. Earlier this week, I got called by a college student who wanted to shadow me for an afternoon to get a sense of it. She's trying to decide what area of medicine she might be interested in. And she said that she has a friend who's an optometrist who said, I don't know if they want to go into that field. It's so mundane. It's the same thing over and over again. And I said to her, that's because your friend is looking at the wrong thing. They're looking at the equipment and not the patient, because there's so many great things that get to be shared. So ironically, one of the first patients that she and I saw in the afternoon was a couple. Gentleman was 70 years old, and I said, what have you been up to lately? He said, I just climbed Mount Everest for the second time. And last winter, he trekked across Antarctica, and he starts telling us this story. So when we finished the exam and went back into my office, I said to the student that was with me, I said, do you still feel like it's mundane? It's mundane if anything becomes mundane when it's repetitive. And it could be a neurosurgeon, which ironically her father was a retired neurosurgeon. That could be mundane after a while, even though the rest of us would see it as fascinating. But nothing is mundane when you wind up sharing these relationships.
So for people who are listening to this and might give you pushback and say, well, I've got so many patients to see, I can't possibly spend the time to do this. You are a very successful practitioner. You've built up a large practice. What do you say to that person? How can they build this into their practice as well?
Well, it's a matter of prioritization, because I'll see, it could easily be 25 patients a day. I have a busy practice, so time is a challenge. I intentionally schedule differently. I'll still schedule an exam on the half hour, and then we'll fill in emergency visits and follow-ups in between. Mm-hmm. But it's spending that little time, and as you learn, if you're an effective communicator, it's not just the ability to communicate with someone, but also to be able to help sort of control that narrative a little bit, just as you have to do with what you're doing now. Is you have to control, you have time constraints, so you may involve a little bit, discuss a little bit, and then move on to the exam, and you look for that segue to do it. It often doesn't take very much time to make a connection, to share a story or two, to listen to a story or two. But the other thing is, as we become more adept at the testing that we do, the testing itself doesn't take long. So I try to make the focus of the time at the beginning to make that connection, or to do that follow-up on the personal relationship we have, and at the end to be able to spend sufficient time talking about what options they may have to educate patients, because patient education to me is critical for helping to retain our patients, to garner referrals, and to reinforce our recall efforts.
And you mentioned things like recall, and I know from just doing research on your site, up on the screen right now, which people can see, is a little sheet that you tend to use, care calls, as you call it. Can you tell us a little bit about what that is?
Yeah, it's a very simple tool. Doesn't take a lot of resources to do this. But if you think about it, in the course of a day, we see patients that for different reasons. Let's say we have a patient that has a corneal abrasion. We want to make sure that they're doing okay. We want to see if they picked up their medication, if our treatment plan is working okay. Throughout my career, I've used these care calls where while I'm in the exam room, I have the patient chart there. So I have their name, their phone number, and I can write something down. So I put it on that list, and I put it in my pocket. If I see another patient that maybe there's a reason I'd want to get in touch with them again, I can add to that list. I do something interesting when I get home. I empty my pockets, and there's this sheet that might have 1, 2, or 3 patient names and phone numbers for me to call. So I make a point of calling them to see how they're doing, to check on them. How are you feeling? Are you doing any better? Is the treatment, did you pick up the medication? Whatever, to show them that I care, which I do. And patients are shocked. And I've gotten some pushback in the past when I've lectured and discussed this. I'm saying, and I spend all day with patients. I don't want to spend all evening. And I say, no, it doesn't work that way. First of all, patients are so shocked that the doctor is calling them. You're off the phone before they think of the other questions they may want to ask. And I find patients to be very respectful of my time as well, and don't keep me on there for long. I give my cell phone number out to patients, and I periodically get text maybe with a picture of what their eye looks like, or a call. But by and large, people are respectful. But showing that you care is another way that can distinguish yourself.
Right.
So that patient might be out to dinner with friends over the weekend and said, you're not going to believe this. My doctor actually called me to see how I was feeling today. And another person might say, I can't even get my doctor's office to return my phone calls. So when you look at it of patients becoming ambassadors for your practice, I believe that all of us who are in this field truly care about our patients. This is just a simple way to show that, and that helps to reinforce that patient loyalty because we're just demonstrating that we care.
You're the second practice that I've heard of, second large practice, where the doc gives out his cell phone number. And I know that on ODwire, we see incredible pushback on that, where people can't believe that you give out your cell phone number, but it really does make the patient feel very special. And it makes them feel like you really care. And so, if it's worked for your practices, these larger practices, I can imagine that it could work for everyone.
I believe it does. I've been doing it for a long time, and it's never been an abused thing. If I've had any problem, there are a couple of times my cell phone has rang, and a patient said, "Oh my God, I didn't realize. I thought this was your office number." And I said, "No, that's the other number." that's about as far as it goes. People are very, very respectful. It's not abused. They're not calling with trivial matters. A lot of times they're apologetic, even if they call my office and leave a message over the weekend in which I'm paged. Very apologetic for bothering me. But, if someone would go and look at the reviews that I've gotten over the years, many of them talk about after-hours situations. And when people are looking for a new practitioner, they look for what are the common themes that are talked about in the reviews. And if they get a sense that it's a very caring office and a welcoming place, and also hear things that when I needed this person after hours in an emergency, they were there for me, are the kind of things that will resonate with prospective patients as well as retain current patients.
Yep. When I was a medical student, I had a surgeon that I shadowed, an older guy, and he just gave me one piece of advice. He said, the most important thing is that you are affable and you are available. Your competence,
It's true. When was the last time someone asked you what your grade point average was?
Right.
I remember early in my practice, it was interesting. When I was just starting out, and I might see 3 or 4 patients in the course of a day, people would say, well, I used to see Dr. So-and-so, but he retired. But, he was one of the best. And I would say, where's the list and how do I sign up? And, but the fact is it was based upon how that doctor made them feel. Now, sure, we're going to be given credibility by our patients until we mess up. But as long as we're doing okay, they'll still, trust us that way. But so much of the credibility we're given as practitioners and our competency is based upon our affability and availability, not just on terms of what kind of grade point average we may have or how great a diagnostician we might be. If a patient doesn't like us and can't get to us, they're never going to find out how competent we are.
Yep, absolutely. Just wrapping up here, I have one final question for you. You were a 2018 Best Practice honoree. And I'm kind of curious, what was your experience of the program, and have you sort of changed your practice at all based on what you learned there?
The program was so far beyond what I anticipated. Filling out the forms, which required some detailed responses about things that might distinguish my practice from another, gave me a chance to really reflect back upon my practice and my career, and that was really enjoyable. We had a summit in Austin, Texas, in which we all had a chance to be together, which was absolutely incredible. And sitting there with this group of people that are so admirable and so enthusiastic and helped to reinforce and remind me of some of the things I do. And then there were things that I learned beyond that. And now we've had a chance as sort of an alumni group to be able to maintain that communication. So there are times things come up that we can now throw out a question to our fellow recipients, to our colleagues, to be able to get that, similar to what ODwire does so effectively in the optometric profession. But one of the areas that we did was we had a chance to do sort of forward thinking, like a think lab, to what may be happening in the future. And what came out of it is how difficult it is to get out of our current mindset, to look at the technology that exists now, to look at the way we do things now, and to really think innovatively of what might things look like in the future. And what's been helpful going through that process is the chance to now really think beyond. I've said for a long time that until the day I retire, I want to spend time thinking of how can I do what I do better? How can I do better today than what I did yesterday? And I think it's critical that we continue to grow. And one of the things that's been a very pleasantly surprising byproduct of my involvement in the program is thinking even further out, going beyond just what's the next step, what's the next 2 steps, but where might things be years from now, and how might I be able to fit in and be a part of that? And it's been the recognition is terrific, and being able to promote that and market that to patients and say, we've been identified as distinguished as a practice is certainly nice and adds credibility. But what I've gotten out of personally has far exceeded what I anticipated.
Excellent. And would you recommend to folks that they go for it and try to fill out an application?
Unquestionably. I had the chance this year to be involved in the review process of this year's applicants, and it was a wide gamut. There were some that might might have written 1 or 2 words down that I was surprised they even submitted, but there were so many enriched practices that are doing such interesting things in their communities and their practices that I looked at and so it's going to be a challenge just to choose 10 out of this group. I think it's absolutely worth the time, and I think that the program is a great one. I applaud Cooper for doing this. They're doing it not to promote contact lenses, they're doing it to promote practices, and I think they've done a great job with it, and the program keeps getting better each year.
Great. All right. Well, Stephen, thanks so much for this, and I look forward to speaking to you in the future.
All right. Thanks so much, Adam. Take care.